Hello everyone. Today our topic of discussion is life and health insurance. As much as we know that no one likes to talk about illness or death or even disability, we should also take cognizance of the fact that the future is unpredictable for anyone. So no one is certain of what can happen in the future, and that is why both life and health insurance are very important. But the learning objectives will start by trying to understand the importance of insurance, to determine your life insurance needs and design a life insurance program, describe the major types of coverage available and the typical provisions that are included. Thereafter, we'll try to design a healthcare insurance program and understand what provisions are important to you. Then we'll try to describe the disability insurance and the choices available. And lastly, we'll try to explain the purpose of long-term care insurance and the provisions that might be important to you as an individual. So like I mentioned earlier, health insurance is an issue none of us can afford to dismiss because no one actually knows what the future holds for him or her. Most of us, we try to avoid thinking about planning for our death because, we just try to live in self-denial. We all know that we're going to die, but everybody thinks, okay, it's not so soon. It's not going to be so soon. I still want to live for a long period of time. So most of us do not seek out a life insurance policy. When you consider your need for insurance, then you need to keep this in mind, right? You need to keep the purpose in mind because there are different types of insurance. So we're going to see the different types and how you can go about, opting for those choices. In terms of the importance of insurance, it depends on the type of insurance because there are different types of insurance, and we all know that the insurance policy will definitely spell out what losses are covered, the types of policy costs, who is going to receive the payment, and so on, who is going to be the beneficiary. So for instance, health insurance now, it provides protection against devastating medical bills. We all know what medical bills is, the trend these days. It's now very expensive to the extent that most people can only afford that with the help of insurance companies or the insurance policies that they have try to invest in. So for life insurance, this is going to protect your family members or any of your beneficiaries by the time you die. So life insurance is not does not basically apply to the insurer, like the person doing the insurance policy, because at the end of the day, it's going to be paid after death. The benefits will be after such a person passes away. So it's going to be the beneficiary, the family member in most cases, that is going to benefit from the insurance policy. Healthcare is expensive for various reasons. Number one is that there is no incentive to economize. Of course, medical care is extremely sophisticated with different medical machines, even researches, and so on and so forth. The cost of research and so on, even the length of medical research at times, it takes up to 10 years for some discovery at times, and all these are still going to boil down to the fact that medical insurance will be quite expensive at the end of the day because medical, drugs and so on and so forth will be expensive as a result of this length of period for completion of these researches to come up with the drugs, for example, or even the equipment. So there are times that there are high malpractice in insurance costs as well. So this has also contributed to the expensive cost of healthcare. High cost mean limited insurance coverage because people will not be able to afford a wider coverage. Limited health benefits, of course, and then a higher out-of-pocket payment for medical bills. What about those that do not have insurance? What about those with no insurance? We have the Patient Protection and Affordable Care Act, which is intended to provide healthcare insurance to those who are not currently insured. As medical costs rise, so the cost of maybe having your financial roof cave due to health-related issues. So it is basically advisable. It's highly essential for people to actually opt for health insurance so that at least they'll be able to take care of themselves. Then do we need life insurance? Like I mentioned earlier, for life insurance, the insurer or the person undergoing the policy is not actually the person who who benefits at the end of the day. For life insurance, the beneficiaries will be maybe family members or anybody who has been stated in the policy to be the beneficiary. So unlike health insurance, where the the insurer is the person that will benefit from that if or in the event that he or she falls sick. For the life insurance, it is after such person must have died that the family member or the beneficiary are going to benefit from such. So through insurance, financial consequences of, sharing, there is a sharing of financial consequences of the risk, and that is referred to as risk pooling. You pool risk together. Then we have the premium. These are just terminologies that are related. The premium is the total amount that everyone puts into the pool, right, into the insurance pool. We also have the actuaries. This is a person who compiles and analyzes the statistics and uses them to calculate insurance risk and premium. When you are engaging or embarking or taking any insurance policy, of course, the premium will be calculated. The premium that you are expected to pay will be calculated. So those who are in charge of that are known as the actuaries. Face of policy are amount of insurance provided at death, or when the person who engages in life insurance is dead, then the face amount of the face policy is now paid to the beneficiary. Policy owner or policy holder, of course, is the person that is holding the insurance policy, while the beneficiaries are those that are dedicated or designated to receive the proceeds after the policy holder must have died. Life insurance doesn't make sense without a spouse or a partner or any dependents, because basically the policy holder is expected to die before any beneficiary can be eligible to collect the the benefits. So if there is nobody to collect it, in terms of maybe your spouse, or maybe you have a partner, or maybe you have dependents or any other family member who is going to benefit, then life insurance may not really be worth it. Should you buy life insurance? These are questions that you may need to answer. You may not want or need life insurance if you are single and you don't have any dependents. So if you are married and you have a double income couple with no children, then you are earning, your partner is also earning, or both of you have different term insurance policies, then and you both have no children, so you may not necessarily need the insurance. You may now consider life insurance if your surviving spouse lifestyle will suffer if you die, or if you are married but aren't employed, you have young children, or you are retired. Your insurance may be on a probability. You may probably need life insurance if you have children, if you are married and a single income couple with no children, if you own your own business, it's very important, and then the value of your estate is over the estate tax free transfer threshold. So if you may want to consider all this for you to be able to determine whether you really need a life insurance policy or not. How much insurance do you need? This depends on your priority and goals, depends on what you want to cover, all right? And then it depends on other things such as the crutch and numbers. For example, your net worth, the inflation, because the market rate will also fluctuate, and this is going to be considered in computing your premium. So, and also your future earnings. You can there are two approaches for calculating this. The first is the earning multiple approach, and the second is the needs approach. For the earning multiple approach, it replaces a stream of lost annual income. It tells you a lump sum needed to replace that stream of annual income, and then it multiplies the present annual gross income by the appropriate earnings multiple, usually between 5 to 15 years, and then the earning multiple depends on the number of years you need, the lost income, and the rate of return. So basically, you estimate the the spending of your family or your dependents, maybe annually or monthly, and then you calculate annually, and that will be multiplied by the number of years in which you're trying to go for the insurance policy. So this is earning multiple for life insurance. The number of years you want to, you want the lost earning stream replaced. You want maybe replacement for 3 years, 5 years, up to 50 years. And then the after tax, after inflation return, assume on the insurance settlement, if it's 3%, 4%, 5%, and so on. For the needs approach, this determines the needs of a family after the death of the breadwinner. So because sorry, the needs approach is going to take into consideration a number of factors. For example, the immediate needs at the time of death, maybe the funeral costs, cost of preparation for the funeral and other things. At times, debt elimination funds, it could be immediate and transitional funds, at least for them to be able to cope with the shock after the demise of the policyholder. The dependency expenses, generally, the spousal life income, educational expenses for children, as well as the retirement income. So all these are taken into consideration in terms of the needs approach. The major types of life insurance are one, term insurance, which is pure life insurance that pays beneficiary a specific amount of money if you die while covered. If you die while covered, it is that specific amount that will be paid in lump sum, all right, to the beneficiary. So it basically depends on the time. Say, for example, if you die within the next 10 or 20 years now, so you'll still be covered. You'll still be covered and your family will be able to benefit from that. But anything exceeding that, that means you are no longer covered with the policy. Cash value insurance has a life insurance and a savings plan. So what's there in the life insurance? What's up with the life insurance? There are different types of policy. I will mention that we have the term insurance, the term life insurance, and the whole life insurance. The coverage period for term life insurance is typically between 1 and 30 years. So it's going to provide protection for a specific time, usually between 1 and 30 years, while the whole life the whole life insurance provide permanent protection until such a policyholder dies. The annual premium for the term life insurance is the least expensive form of life insurance. All right, it has a low initial premium. The initial premium you're going to start with is going to it's going to be low, with the premium increasing as the insured gets older. As you get older, then the the premium now starts to increase. Meanwhile, for the whole life insurance, the premium you'll be paying is fixed. For the death benefit, you're going to get a fixed death benefit for both, whether it is term life insurance or whole life insurance. It's a fixed death benefit and will be paid to the beneficiary. There is no cash value in terms of the term life insurance, while the cash value is fixed for the whole life insurance. So these are basically the major highlight of the major differences between the term life insurance and the whole life insurance. So more on that, we have the universal life insurance and the variable life insurance. For the coverage period of the universal life insurance, it provides permanent protection, as well as in terms of the annual premium, it allows flexible premium payments. So the policy holder can vary the amount and the timing of the payment. You may want to pay annually, you may want to pay, biannually or quarterly or monthly, things like that. So the death benefits are also flexible, for both universal life insurance as well as the variable life insurance. In terms of the cash value of the policy depends on the level of payment made and the investment result of the insurance company, while the cash value of the variable life insurance is dependent on the performance of the mutual fund in the cash value account. In terms of the term insurance, it pays the death benefit if the insured dies during the coverage period. So there is a specific coverage period which will be stated in the contract, and if the death occurs within the coverage period, that means the insured is still covered. So the beneficiaries can benefit from the term insurance. It has no face value, and the primary advantage is affordability. It's affordable compared to the life insurance. The disadvantage is that the cost of increase each time the policy is renewed is quite high, right? Once the policy is, once the period for which the insured is almost or for which the insured is covered is almost lapsed, and he or she may not want to forfeit the contract, so the person has to renew. So the cost of renewing such contract is quite very high. So here is the rising cost of yearly renewable term insurance. The term insurance and its features. That we have renewable term insurance. These are the features of the term insurance. Don't forget that we said a major disadvantage is that the insured really has to renew the contract, because otherwise it's going to forfeit the policy as long as the term is lapsed and he or she is still alive. So if such a person dies within the coverage time, then the person can get the benefit, the family or other beneficiaries can get the benefit. But once it doesn't die, he or she is going to forfeit the coverage. So in order not to forfeit that, they have to renew, and that is going to cost more again. So there is the renewable term insurance, there is the decreasing term insurance, the group term insurance, the credit and mortgage group insurance, as well as the convertible life term insurance. So all these are the features that are associated, or the features of the life term, the term insurance, sorry, as against the life insurance, which covers the insured for the period of his or her lifetime. Cash value insurance and its feature. The cash value insurance provides both a death benefit and an opportunity to accumulate the cash value, right? It's permanent. You pay the premium and eventually you get paid at the end of the day. There are basically three types of the cash value insurance. We have the whole life, we have the universal life, as well as the variable life cash value insurance. The whole life insurance, of course, when the death benefit, the death benefit is when the insured dies, turns 100 or reaches a maximum stated age. So for a whole life insurance, it's going to cover from the commencement of the insurance policy until the insured dies. It could be earlier than planned, it could be later than planned, or until the insured turns 100 years old or reaches the maximum stated age. Cash value is related to the policy holder's savings, right? It's more than just a simple life insurance, as it has two components. It could be the life insurance or the savings plan. So we have the non-forfeiture right as well in relation to the whole life insurance. This gives the policyholder the right to choose the policy's cash value in exchange for giving up the death benefit. So at times, some people may opt for this non-forfeiture rights. Non-forfeiture rights, which gives them the right to choose the policy's cash value in exchange for maybe giving up the death benefits. They are given a certain cash value. Then there are different premium payment patterns for the whole life insurance. There are different premium payment patterns. Moving ahead, we'll talk about universal life insurance and its features as well. For the universal life insurance, it combines the term insurance with the tax deferred savings with flexible premiums and benefits. It's flexible because the premiums can vary. All right, the premiums can either increase or decrease depending on the situation or the contract. Mortality charge on term insurance, cash value or savings, and administrative expenses also applies to the universal life insurance, and it may not end up with the anticipated amount of savings at the end of the day, because we mentioned that premiums can vary as they are flexible. Do not forget. So here is determining the cash value on the universal life policy. The cash value might increase if the new premium policy, payment from the policyholder, if there is a new premium payment from the policyholder, or it's credited interest from the insurance company. So, and it might decrease if the administrative expenses increases or the mortality charges or the cost of insurance also increases. So these are the factors that can determine the cash value of the insurance policy. It might increase due to a number of factors, and it might also decrease due to a number of factors. Term versus cash value insurance. For most individuals, the term is the better alternative. They want to go for the term insurance as against the cash value insurance. One, due to the low cost, it's quite affordable, and the high cash value premiums can lead to less coverage than you actually need. When the value premium is very high, then you may not be able to cover the insurance policies that will be covered will be quite less. The cash value insurance has tax advantages. There is growth of the cash value, all right, and then the life insurance is not considered part of your estate. Life insurance is not considered part of one's estate because at the end of the day, it's only the beneficiaries that will get the benefits at the end of the day. So, and that must have been after the insured is dead. Fine-tuning your insurance policy, contract, clauses, riders, settlement, and options. In the world of insurance, there is really no standard policy. All right, if you care to know that, there is no standard policy. There is no one size fits all. So it's more or less like you want to customize your own insurance policy. You want to know what you are opting for. You opt for what is best for you, options that are best for you. So it could be a combination of different options. So there are different provisions that you can use to personalize or individualize your own insurance policy. But the most important thing is that you have to read that legal document or the contract, and as well as the clauses that are used before you sign the contract. And in doing that and understanding that better, you might need to get the assistance of a professional. So there are different clauses that are associated with this contract, insurance contract. So we have quite a number of them. We might quickly go through briefly. For example, we have the beneficiary provision. where the primary beneficiary is the person designated to receive the death benefits when you die. So there is an express statement of the person that, okay, once I die, okay, you can, this so and so should be the beneficiary. So the primary beneficiary will be the person that is designated. So that person might now have the what is it called? So might not be given maybe another level of instruction or authority on how to share it, but he or she will be the main beneficiary that will get it, that will get the benefits from the insurance policy. I mean the insurance company. We also have the coverage grace period. This gives you an extension of the of the general, an extension which is maybe generally 30 days in which to make your premium payments without cancelling your policy. At times when you default, then your policy will be automatically cancelled. But when you have the coverage grace period of about 30 days, you can still make up for your premium. All right, you can still make up for your premium without your policy being cancelled outright. So we also have the loan clause. All right, the loan clause allows you to borrow against the cash value of the policy. The rate is usually favorable, maybe no fees or maybe no charges. So it's at times usually favorable. It allows you to take some cash for the from the value of the policy. Then we also have the non-forfeiture clause. For the non-forfeiture clause, it defines the choices available for the policyholders who miss the premium payment. So it causes the policy to lapse. We also have the policy reinstatement clause, which deals with the conditions necessary to resolve a lapsed policy. Say for instance, you've defaulted in the premium, the payment of your premium. So with this policy reinstatement clause, it deals with the conditions that are necessary to resolve any lapse policy to its full force. All right, and then we also have the change of policy clause. The change of policy clause allows you to change the form of your policy. For instance, you might want to convert your maybe continuous premium whole life policy to a limited premium whole life policy. So changing from one policy to another is not automatic. This clause has to be stated in the contract. Then we have the suicide clause, which almost all insurance and contracts include in their own in the contract. It states that the insurance company won't pay off for suicide deaths, God forbid, that occur within the first 2 years of the contract. So maybe for some people it might be suspected that they intentionally go for the insurance policy just because they already knew their intention to commit suicide. So once they seal the contract, they just go and try to commit suicide so that their family can benefit and so on. So for most of these insurance companies also, it's clearly stated in their contracts that there is no payment for any suicide or any suicidal death that occur within the first 2 years of the contract. Then we have the payment premium clause, which says that it states how you pay your premium. It states how you pay. You pay your premium. For example, you want to pay it annually, you want to pay it semi-annually, twice a year, you want to pay quarterly, you want to pay monthly. So this is taken care of by the payment premium clause. And lastly we have the incontestability clause. This states that the insurance company cannot dispute the validity of the contract after a specified period of time, which is usually 2 years. So for the insurance company as well, they cannot deny that they cannot dispute the validity of any contract after a specific period of time. Riders, what are riders? Riders are actually special provisions to your policy, right? They are special provisions to your policy, often at an additional cost to provide maybe extra benefits or features to a policy in order to meet your own specific needs. Like I mentioned earlier, there are different kinds of insurance policy and there are different options. So there is no one size fits all kind of policy. So I mean, for riders, it allows you to, customize your own. I mean, there are provisions that are made or that may be added to your policy. There are provisions that may be added to your policy just to personalize them for you. All right. There are waiver of premium of disability rider. We have the accidental death benefit rider or multiple indemnity, guaranteed insurability rider, as well as the cost of living adjustment rider, and lastly the living benefits rider. So all these are forms of riders that can be opted for in terms of the insurance policy or in terms of customizing the insurance policy. Settlement or payout options. These are kind of alternative ways a beneficiary can choose to receive a policy benefits upon the death of the insured. So once the insured dies eventually, there are various alternative ways in which the beneficiary or the family members can choose to receive the benefits. For example, it could be a lump sum settlement, it could be the interest only settlement. They may go for installment payment settlement or life annuity settlement, which could be of different types as well. We have the straight life annuity, the certain period annuity, refund annuity, as well as the joint life and survivorship annuity. Buying the life insurance basically has to do with choosing an effective or efficient run life insurance company that will be around when your policy matures. So this is a very important aspect of insurance, embarking on insurance policy, because you don't just wake up one day and say you want to go or you want to take an insurance policy without doing your research on that, maybe on different aspects, the companies, what they offer, the different types of insurance, even maybe the premium and so on and so forth. So choosing an efficiently run life insurance company that will be around when your policy matures is very, very important. And in trying to do that, you have to select an agent. And in doing that also, you should be very careful, as most agents are, they make their living through commissions. So they might want to persuade you to, go through or opt for specific kind of insurance policy. But once you do your own research very well, you'll be able to, take the policies or go for the policies that that are in your own best interest. Be aware of the agents and professional designations. List the prospects from the good companies. Interview the agents and get a code. You have to, get a quote. You have to interview different agents before you, decide on which or who to deal with, and you get different quotes from them for you to be able to decide which one is more favorable to you. So here is a table showing the insurance and company ratings. Right, we have the superior, excellent, good, and the just adequate. Apart from the just adequate, we have the below average, the financially weak, and the non-viable. So if you want to get more information about the rating of insurance companies, you can visit those websites that are meant for, that are designated for rating insurance companies. For example, AM Best, Fitch, Moody's, Standard & Poor's, and the Waidsum. So all these are insurance rating company websites. Buying life insurance, you have to compare the costs when you are buying the life insurance, and in doing so, you can opt for either the traditional net cost method, which sums up the premium over a stated period of time, usually maybe 10 to 20 years, and is now going to subtract this, it's going to subtract from this the sum of all your dividend over that time period. So you sum up the premium, and then the dividend over that period will be deducted. The second life insurance cost method is the interest adjusted net cost. That's the IANC, interest adjusted net cost method. This method incorporates the time value of money. All right, it is also called the surrender cost interest. For the traditional net cost, it doesn't take into cognizance the time value of money. So it's only going to sum up all the premium over a stated period of time and subtract all the dividend for that same period. But for the interest adjusted, it's going to consider the time value of money. So still on buying a life insurance, we'll be talking about making a purchase, all right? The net or an advisor. For example, you have to shop for term insurance on the web, like I mentioned earlier, that you have to, try to visit websites to know the ratings and the likes, to read the reviews, and to know more about each of the insurance companies before you can consider anyone. Check at least 2 web code services and call an independent insurance agent. These are just ways in which you can actually take precaution before taking up any policy with any insurance company. More complicated to compare cash value policies because of the different features and assumptions. So it may not be that easy for you to compare the cash value policy. You can still get quotes on the web for different cash value policy, but most importantly, you need to discuss with agents. All right, you need to discuss with different agents and seek their opinion on these insurance policies. Moving away from life insurance, now we're moving ahead to health insurance. As against the life insurance where the insured is not the beneficiary, in the case of health insurance, it's the policy holder, that's the insured, that is actually going to benefit. All right, the Patient Protection and Affordable Care Act of 2010 ensures most Americans have health insurance. Mostly the Obamacare, if you can recall, is one of the policies to ensure that most Americans have access to health insurance. There are employer-sponsored healthcare coverage. Your choices are limited to what your employer offers in this situation. For most people, it's their employer that take care of their health insurance, all right, the company with which they are working for. And if that should be the case, the choices are limited to what the employer offers in terms of the insurance coverage. Additional coverage may be available for additional payment. So if you want more coverage than what your employer, has paid for or is responsible for, then you may need to pay for the additional coverage that you want for yourself. Then you can also make changes to this kind of employer-sponsored health coverage on an annual basis. You may want to, add some coverage if they are not in or within what your employer has actually covered. And if you think that maybe over time you want to change them, you don't want to include them any longer, you can still make such changes on an annual basis. The health insurance exchange is also available, and this contains a range of private private plans to choose from. Excuse me. So you can choose from different private plans in terms of the health insurance exchange. There are different healthcare reforms by the American government, like I mentioned before. This was signed into law, like the Obamacare was signed into law in 2010 by President Barack Obama, and this is commonly referred to as the Affordable Care Act in America. So it provides new the new consumer protections for Americans. It improves the quality and lowers the costs. So there is improved quality health care, but the cost is lower. It increases access and access to affordable care, and it holds insurance companies accountable. Actually holds insurance companies accountable, unlike before the act was enacted. So these are the major provisions of the Affordable Care Act, providing new consumer protection. It prohibits insurance companies from denying coverage to children under the age of 19 due to pre-existing conditions. It prohibits insurance companies from rescinding coverage due to an error or other technical mistake on consumers' application. It eliminates lifetime dollar limits on essential benefits, and so on and so forth. So you may really need to read this. Improving the quality and lowering cost. In terms of doing this, or in order to achieve this, the Act provides some small businesses with tax credits to help them provide insurance benefits to their workers. Some are not. Some are small businesses, small and medium enterprises. So they are also covered under this Obamacare Affordable Care Act. So it faces out the medicine drug do not hold coverage gap. It requires that all new plans cover certain preventive services such as a mammogram and colonoscopies without charging a deductible copay or co-insurance. So all these are ways in which the Affordable Act Care has tried to improve the quality of insurance or quality of health and lowering the cost of health. In terms of increasing access to affordable care, the Act ensures that children will be allowed to stay on their parents' plan until they turn 26 years old. So they remain on their parents' plan until they're around 26. It increases access to Medicaid by allowing those who earn less than 133% of the poverty level, all right, to be eligible to enroll to Medicaid. It's also hold insurance companies accountable, and this requires that at least 85% of all premium dollars collected by the insurance companies for large employer plans be spent on healthcare services. So the US government has really tried in terms of providing affordable healthcare to the citizens with this Affordable Care Act. What are the basic health insurance? Most health insurance contain a combination of hospital, surgical, and physician expense insurance. So, hospital includes maybe the cost of room or bed or things like that. Surgical includes the cost of surgeries and so on, and then the physician as well, the cost of the charges for all the services of the physicians and maybe other specialists. So most insurance contain a combination of these three major aspects. Major medical expense insurance covered expenses not covered by the basic health insurance. For the dental and eye insurance, they are used for minor regular dental or eye examinations, glasses or dental lenses, contact lenses. So for the dental, it has to do with your oral hygiene and so on, the teeth specifically or majorly. And then eye examinations, that's for the eye insurance. It covers the eye examination, glasses, and contact lenses. You don't buy if the employer doesn't provide it. It's a regular expense that can be planned for, because it's not something you go, like more often or as regular as it is. So if your employer does not really buy it, you may not necessarily need to include that in your insurance, because it's something that's usually affordable, and it's regular expenses. For example, maybe you expected to see a dentist at least twice a year, that's once in every 6 months. So you can actually plan for that if your insurance does not cover the dental or the eye insurance. There are different basic healthcare choices. We have the traditional fee-for-service or indemnity plan. These are reimbursed for medical expenses and expenditures and the choice of your doctor. They are managed healthcare or prepaid plans also. We have the prepaid care plans. Most of these expenses are covered for limited choice of doctors, at times hospitals, at times clinics. So for the traditional fee-for-service indemnity plan, you'll be reimbursed for the medical expenditure and the choice of doctor. Maybe you have to go see the doctor, pay for your health charges and so on, then you now go and claim it from the insurance company. While the managed healthcare, most expenses are basically covered, but there is limited choices. There are times that will be limited to, okay, you have to go to a government hospital. If you want to use the insurance, you have to go to maybe specific hospitals or specific clinics, or you have to see so choices of doctors. If you need to see specialists, then it has to be strictly on referral, maybe by the primary healthcare giver or something like that. So there are some conditions that are attached to the managed healthcare or the prepaid care plans. The private healthcare plans include fee-for-service plan or traditional indemnity plans. We have the managed healthcare as well, which are offered by the health management organization. They receive all healthcare at one location and the visit fee for co-payments. Here is a checklist showing how to choose or choosing an HMO. All right, that's the health maintenance organization. There are different options. So are there many doctors to choose from? Do you select from a list, or how hard is it to change doctors if you decide that you want someone else? All these are some of the things that you want to consider when you're choosing a health maintenance organization. How are referrals to specialists handled? At times it's quite difficult or challenging to get referrals to see specialists with some of this management maintenance organization. Is it easy to get appointments? Does the HMO offer services that you want? What preventive services are provided? So all these are things that you need to find out before you choose any health maintenance organization. Still on the private health care plan, we have the managed healthcare, all right, which is through the HMOs, that's the health and maintenance organization. It could be individual practice and association plan, it could be group practice plan, or point of service plan. HMOs are generally cost efficient, their service can be too quick, all right, and then lack of choice can be can be too restricting. You might be too restricted to very few choices when you are taking these private healthcare plans. The managed healthcare, in terms of the PPO, that's the preferred and provider organization. This crosses between traditional fee-for-service plan and an HMO, that's the health and maintenance organization. Doctors and hospitals agree to the pricing system, and they allow for health at a discount. They give a discount at an arranged rate. We also have the group versus individual health insurance. The group health insurance are sold with no medical exam. They are required to, no medical exam required to a specific group of individuals who are associated for some purpose only. For example, maybe employees. Most of the employers embark on or they opt for the group health insurance. In that case, there is no medical exam required for the group, before they can be eligible. For individual insurance policy, these are tailored made for you, for one person or an individual, and it reflects the age, the health, and done after medical exam. So there is also a need for a medical certificate for the individual insurance policy. In terms of the essential benefits, the Affordable Care Act requires that certain essential benefits are covered. For example, the ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, prescription drugs, laboratory services, preventive and wellness services, pediatric services, as well as rehabilitative and habilitative services and devices. So all these are the essential benefits that should be covered. Appealing health insurance claim decisions. If your health insurance has denied coverage of your medical care you receive, then you have the right to appeal the claim and ask the company to reverse its decision. You must be your own healthcare advocate, and these are the necessary steps that you can follow in order to do that. You have to review your policy and get an explanation of the benefits. Contact your insurer to keep detailed record of your contacts. Request documentation from your doctor or employer to support your case. Then you write a formal complaint letter explaining what care was denied and why you are appealing via the company's internal process. And lastly, if the internal appeal is not granted, then you can file a claim with your state insurance department. So these are the steps in which you can follow in terms of appealing your health insurance and claim decision, especially when you are denied coverage of medical care. We have government sponsored care plans, which could be state plans or the federal plan. For the state plans, they provide for work-related accidents and illness. There is worker compensation. Or for the federal plan, we have the Medicare, Medicaid, and so on, depending on the country. This Medicare, Medicaid are for the United States. Medicare has, different parts. We have Part A, B, C, D. Part A is the hospital insurance. Part B is the supplemental medical insurance. Part C is the Medicare Advantage plan, while Part D is the Medicare prescription drug coverage, and we also have the Medigap plans. Here is the Medicare coverage choices. The figure shows the Medicare coverage choices, which you may refer to. For the Medicaid, the government medical insurance plan for the needy families. It's the function of the government, the role of the government to plan for the needy families. There is a joint federal and state program. Some are covered by Medicaid and they are also covered by the Medicare. But for the Medicaid, it is limited in scope. How do you control healthcare costs? You should know that the first thing when it comes to controlling healthcare costs is to stay healthy, as this is the most cost effective. All right, this is the most prudent way. It makes healthcare costs cheaper and accessible, especially when when you are health conscious enough to be able to control your health, to live a healthy lifestyle. So we have the the flexible spending account, which allows pre-tax dollar to be used for qualified healthcare and childcare expenses. We also have the HSAs, that's the health and savings accounts, which are normally paid for healthcare expenses tax-free. Then we have the COBRA in changing jobs, that's the Consolidated Omnibus Budget Reconciliation Act, and the changing jobs. So this will enable one to continue the health coverage even if you change your job. And lastly, if you choose not to opt for any insurance coverage, you will be penalized for that, apart from the fact that you will be responsible for your own medical care or medical expenses. So if you choose not to opt for any insurance, you'll be penalized in the United States, in addition to the fact that your medical expenses will be taken care of by yourself. So what do you look for in any health insurance plan? Who is covered? All right, what do you look out for? Who is covered? Is it the insured? Who are those that are insured? Then what are the terms of payments? How will you be paying the premiums? And who are those that are excluded from the insurance plan, the health insurance plan? There are different ways in which you can choose insurance plan, or there are different plans in which you can choose from. Health insurance marketplace categorizes plan into 5, right? We have the bronze, silver, gold, platinum, as well as the catastrophic. For the bronze, your plan is going to pay 60% while you pay 40%. That's your insurance plan. You cater for 60% at the end of the day in case of any medical need. For the silver, if you are under the silver plan, your plan pays 70% while you pay 30%. For the gold, if you are opting for the gold, your plan pays 80%, you pay 20%. For the platinum, your plan pays 90%, you pay 10%. For the catastrophic, the coverage option, if you are under 30 or have very low income. So these are the different insurance plans that are available and for people to, or for the insured to select from. So depending on the policy, you might want to opt for any of the bronze, silver, gold, premium, or the catastrophic. We also have the disability insurance apart from the health insurance. This is the health insurance that provides payments to the insured in the event that income is interrupted by illness, sickness, or accident. So disability insurance is the health insurance that provides payment for all those. Okay. Then apart from that, anyone who relies on income from a job needs this disability insurance. It's very important to note that a 30-year-old has a 47% chance of incurring a disability that would cost 90% or more, 90 or more missed work days. But generally, these insurance are expensive. These disability insurance are generally expensive. Sources of disability insurance are: 1, the employer, the social security, the workers' compensation, as well as the individual policy. This is a sample of the worksheet for estimating how much disability insurance coverage that one needs. Disability features that make sense includes: 1, the definition of the disability. It has to be stated expressly. The residual or partial payment, the benefit duration, the duration within which the benefits will be, the one will be entitled to the benefit, the waiting or elimination period, the waiver of premium, the non-cancelable, and as well as the rehabilitation coverage. So these are disability features that are important. In terms of the long-term care insurance, this pays nursing home expenses and home health care. It includes the nursing expenses and home health care. It covers costs associated with long-term care for those against the financial cost of Alzheimer's, strokes, or chronic diseases. This requires that insured cannot perform activities of daily living. All right. In terms of the long-term healthcare provisions, it is necessary, the following are necessary. One, the selection of a company. You have to consider only high quality insurance company with either an A11 or A1 rating. All right. Then you have to check for qualifying for benefits. The insured is unable to perform at least 2 activities of the daily living without assistance. So for you to be able to qualify for the benefits, that means the person must be unable to perform at least 2 activities of daily living, which have been mentioned previously. So the policy includes coverage for Alzheimer's as well as Parkinson's disease. Hospital stay not required for the benefits. The benefit period is a minimum of 3 to 6 years period, and the inflation adjustment requires that the policy should give you the option of purchasing inflation coverage. And lastly, the policy should not be cancelable. So the other ones that are desirable but not necessary are the cost and benefits trade-off. For example, the waiver of the premium. While it's desirable, it may be too expensive to warrant serious consideration. It may be too expensive. Then the type of care, is it home care, is it adult daycare, or is it hospice care for the terminally ill? The benefit period should also be taken into consideration, or it may not be necessary but desirable. Women should consider longer benefit period. These are the cost. We also have the cost reducing provision that one may need to consider. For example, the waiting period. You have to consider a waiting period of 100 days or more if affordable. The provisions to avoid or not what the costs are, the non-forfeiture clause or provision, which is quite too expensive or very expensive. So these are long-term care insurance. For example, medical advances have resulted in increasing the need for nursing home care as well as assisted living. So most health insurance plan and Medicare, they limit or exclude the long-term care. So there are some questions that you need to consider, when separating a long-term care insurance policy. So consider what qualifies you for the benefits. All right. At times, some insurance say you must be unable to perform specific number of activities on a daily basis on your own. For example, eating, walking, getting from the bed, dressing, bathing, and so on. Then what type of care is covered? Does the policy cover nursing home care or maybe assisted living facilities and so on? What will be the benefits amount? All right. What is the benefit period? For how long are they going to pay? Is the benefit adjusted for inflation? All right. In case there is inflation, will the benefit be adjusted, or is it just a fixed amount regardless of the rate of inflation? And then lastly, is there a waiting period before the benefits begin? So all these need to be considered in terms of long-term care insurance. The type of care involves or includes the nursing home, the adult day care, hospice care for any terminally ill person. The benefit period can range from maybe 1 year to a lifetime. The waiting period can be from 0 days to 1 year. The inflation adjustment can be protected for. right? The insurance can be protected from inflation adjustment, and there may be waiver of premium whereby the insurance stays in force while receiving the benefits. So for today, generally, we've discussed about the life insurance control, all right, and the financial effect on the family when someone dies. There are two types of life insurance, the term as well as the cash value. We also mentioned the fact that basic health insurance provide combination of hospital, surgical, as well as physician expense insurance. In addition to that, we discussed the fact that there are major medical expense insurance, you know, coverage as well as the costs. We discussed about the disability insurance, and lastly, we discussed about the long-term care insurance as it covers the cost of long-term nursing home care. So this brings us to the end of our discussion for today on our health and insurance topic. Hopefully, we'll see again we'll be taking up another topic in the next class, inshallah. Before then, please do take care of yourself and stay safe. Bye.